So if you don't have a health license right now, that's completely okay. If you're like me, I'm one of those individuals. Just because I don't do it, I want to know what it's all about. I want to have my hands in not everything, but in the right things. Because something that you do may lead you to the next thing, or you can open a door for someone and you can be part of that network. You can do all of those things just by having the knowledge, right? So when you have that knowledge is power. And that's why when you come see I go to an event, I put on my thing the power of life. The power is so much that's into this license and everything that we do. And it's something that I should have did a long time ago. I always thought life is everything. I don't even know why people do health. And the one person that's gonna come up tonight has been telling me to get my health license. She was telling me to get my life together too, but she said, "Hey, get your health license. It's really important." So last year, LSG, I said I took the lead to say I'm gonna get my license, y'all. That's when I started to learn a lot about like, man, I could I've been leaving so much money on the table because I thought one license was the catch all. No, health is where the money is. Okay. Health is definitely where the money is. That's how I came across Miss Lori Watson. That's how I came across a lot of other agents within LSG2 as well when it comes to the health license, right? So, to do the quick introduction, I want to introduce you to someone that I pretty much known for a long period of time, right? When they was taking cabs, private cabs and stuff, I've known we got a little bit. I'm the older one. They everybody call me Unc on the trip, but I've known Marquita since the '90s, right? Um, Definitely from grew up on the south side of Chicago, and she married a awesome young man, Mr. Derek Solomon, and they're out there in I want to say Nashville, but Franklin, Tennessee, running the Hard Bargain Association, where there's a lot of history there. I'm not going to step on any toes with that. And then with that, she is a person that likes to read. She likes a person that loves to do research on everything, right? And some of you, look, I won't tell you she's tough, right? She gonna tell you to read, right? So don't ever call her thinking you're gonna get a quick answer, because not even I get a quick answer, right? She makes sure that you read, and that's the foundation of how things are supposed to be. So with that, definitely, I want to give the mic up to Miss Marquita Solomon. Go ahead and take us away.
Good evening, everyone. As Cedric said, my name is Marquita Solomon, founder of Solomon Financial Solutions. And this evening, I'm actually just going to go over open enrollment checklist. So, whether you have your license or you don't, this is something that I do to help me prepare for open enrollment. Um, so, I'm just going to do a quick, just share my screen. Can everybody still hear me?
Yes.
Yes, we
Good.
can.
All right, all right. Give me 1 second. Just want to make sure everybody can see it. So, like I said, this is an open enrollment checklist for brokers. This is actually something that I found online because I was going to create my own, but I realized that there was a checklist already out there. So, some of the things that I do and some that I don't, but I just wanted to just do a quick overview. Um, they ask for you to complete your FFM certification. So, for those of us that have our health license, how many have actually taken their FFM certification?
I bet
I
it's
just finished it.
bet it's beautiful.
All right.
So
So,
I have it, and so who all here? If you can put in the chat, Who all has a health license? If you can put it in the chat, so that way we don't miss you.
Okay. Okay. See, Lori says she has it. I know Ebony is in progress. Yes.
Gotcha. Even
Larry does.
Larry's got
Okay.
one. Mm-hmm.
And Teresa, all right. Also with this, because what I did not do, I don't do Medicare, so I don't do over 65, but I also forgot to put a slide in here about the AHIP certification. Those are out as well. And I know that I don't think a deadline is in fact in place for the AHIP, but I did want people to know that what you'll still have to do your FFM, and then you'll have to do a AHIP certification so you can sell to Medicare for people over the age of 65. Um, Also, familiarize yourself with the changes in healthcare. Every single year, there are changing rates. There are plans that come and go off the marketplace. Um, there are different laws that come into play as well. And it's easy to get lost in that space as a client. So for us as agents, it's better if we go ahead and try to familiarize ourselves with the comings and goings of the healthcare industry. So we make it an easier process for our clients. And along with that is getting to know your local market, because not all carriers are in every single state, or not all carriers offer the same products in every single zip code, because everything is by state, county, zip code, state, city, county, zip code. Yeah. And so once you familiarize yourself with your market and become an expert in that field, it'll go along smoother as well. You just make that process easier. What I also do is schedule check-in meetings. So before open enrollment even starts, like I still do periodic checks with my clients throughout the year. So that way, when it's time for open enrollment, um, I'm asking, hey, do you still have anything to update? So anything from previous period. Did your employer change? Did you move? Did you get married, have children, things of that nature? Because all of that does affect the ACA, or the Affordable Care Act, if your client is in there. Um, this one says understand your client's employee population. This checklist is actually for agents or brokers that work with small groups. If you don't work with a small group, that actually isn't for you, and that's fine, because I don't do a whole lot of small groups, but that is still something that you should learn. Um, Deadlines. We have to remind our clients of the deadlines. Let them know the actual dates for open enrollment. Let them know when it's about to begin, when it's about to end, the when they have their last chance to make changes, um, and then their start dates. We also, I don't prepare forms, but I do have resources and other materials that may come from the carriers. But also the forms that I use come from where we are. We're at Peak, and I get a lot of their forms offline, and those are what I use for my clients. This makes it easier because they already made them. Um, it also says establish a communication plan. So again, it's about what is being offered, the deadlines, how to access benefits, and things of that nature. And then you review your current technology process. So, what do you have in place to help you keep you being efficient and organized, and being also in compliance? Um, I'll tell you what I use. I actually have a CRM. Okay. Gotcha. So their client data intake form is something that I use from Peak. Is already um, It's on their roadmap, but also it's in their resource section. It'll actually also have the updated federal poverty guidelines, because a lot of things I do use are from Peak themselves. I can actually log in a little bit and then show you where I get my resources from. Um, and what I do before open enrollment begins with my clients, my previous clients, I send them out a form and I ask them to fill it out if there's anything that needed to be updated, just in case. Because some people don't realize, hey, they got a raise, or, loss of hours or whatnot, move to a different zip code. And what they do once they fill out that form, I already have their budget, I have their medications, I have all the people in their households on there. And then I take all that data and then I start researching early and pulling quotes. And I do 2 to 3 quotes. I make sure I have their doctors on there as well and their medication. So once I do pull the quotes and things, I'm making sure that these doctors are in network and then their medications are covered. So when I come to my client, they have 2 to 3 options that they can choose from, and then we go from there. And with that, my and that's the appointment that I also collect payment on. So I give them their 3 options because I've already done it. My review with them is only a 15-minute appointment to go ahead and sign them up because I've already done the work beforehand to try to make the process easier. And then I know that the only thing I'm collecting on that appointment is the payment method. So that way they're already done, and then I could check that client off the list and move on to the next person. Um, this is kind of what I do as a communication timeline. Like a month before open enrollment starts, I send off a kickoff email. I'm pretty sure there are many templates online that you can use, but I send them a kickoff email. Um, 3 weeks before the start date, I do ask them about any changes for the previous year, but I also, depending on the carrier that I sign them up with, make sure that it's a carrier specific email. So I let them know what changes, if their plan is still on the marketplace, if that plan is going to go up in price, if that plan is no longer available, and things of that nature. So that way they have 3 weeks before open enrollment begins to know, like, dang, this is going away. Um, the morning of open enrollment, I send out another email that says, hey, welcome to the first day of open enrollment. How would you like to proceed? Because I've also, before all of this, I've sent out the kickoff email includes the client data worksheet, and I asked them to send it to me back as soon as possible. So in this morning of, I reiterate like, hey, I sent you an email a couple of weeks ago asking about, for you to fill out this client data worksheet for any updates or any changes that may have happened. About 2 weeks before the end of open enrollment, I let them know that, hey, this is a deadline approaching. So these are for all my previous year's clients. So I do let them know, like, hey, we have 2 weeks left. Let's get the ball rolling. How can I help you get this process going? Some people you do have to go ahead and call, and I'm okay with calling them and following up with them. I'll get you in one moment, said. And you just got to say, like, hey, we have to get this done because your plan is going to go to 400 and whatever dollars a month, and you were just paying 38. So what do you want to do? Um, but yeah, how can I help you, say it?
Question that I had, so I love the email the kickoff, right?
Yeah.
And I guess, you know, I'm trying to find a way to ask the question of like what does that all entail? Are you sending that to just your previous clients from the previous year, or
Mm-hmm.
you sending it to maybe new clients that you got on a distro list? Who do
Well,
you
I don't have a distro list. Everything I do, whether I get people from an event that I worked or previous clients or things of that nature, because I've already gotten their information. And 75 to 80% of those people actually filled out a client data worksheet and they're just waiting for open enrollment to begin. But I also still go ahead and send that email. It includes the dates of open enrollment. Um, it includes my links to like the Health Sherpa if they want to do it themselves so they can run their own quotes and they can sign up for themselves. It also includes my website where they'll be able to sign up for the dental, the vision, and hearing plans. I just try to make it easier for my clients to be self sufficient. Um, I don't do a whole lot of hand holding. It said, like to mention. So the the more streamlined the process is, I find that clients will go ahead and do it themselves, but there are still people that have questions and want you to do it with them. And I'm okay with doing that as well. But I like the fact that there is a nice number or majority of people that will go ahead and sign it up for themselves. And if I have to go in and make changes, I'll do it. But they made that initial, they tried to do it on their own, and I'm okay with that. Do we have any
Question.
more questions?
Yeah, I got a question. If they sign up for themselves, do we still have to do the agent of record and stuff like that?
Absolutely, because they're signing up through your link. That's what I'm saying. My email includes all my links. So everything is tied to my NPN that I post and that they use. They're literally signing up on my websites, on my links, on my personal links. And I see you as well, Kenneth Williams. You got a question?
Yeah, I think you actually just answered it. It wasn't as
Okay.
far as where you with when they filling out that information, you track. Well, I'm guessing that all of that is feeding back to your CRM. So when
Yes,
you
sir.
send out your emails, it's all shooting from that platform.
Yep. I shoot it all from my CRM.
CRM, yeah.
Yep. We just create an email and keep going. And I got you, Sandra. I hear you. I know you want an example of the email, but I have actually just cleared out. My husband has to fix my mess up because I'm not the most technology advanced person. And I cleared a lot of my templates. So Derek has to go in and fix it within the next couple weeks. And Lori, I see you have a question as well.
Yes. When you are doing the preparation of like the pre-quotes, is it showing you for the plans for 20, like for the current year, or is it showing you the plans for next year?
It's like a small window when they stop the 2024 quoting, and then you can see 2025 windows. So that's when I'm actually doing all the pre-quotes, because there is a time on this where they're going to stop 2024 quoting. You won't even be able to see 2024 at all
All
for
right.
open enrollment. Yep. And
Okay.
then that's how I get all these done, and I make my notes and I keep it pushing.
Gotcha.
All right. Said he will design a template and put it in the drive. But Sandra, once I get my templates back, I will most definitely text you or email you a copy of my templates. So you'll actually see each one from each each milestone. So I do have a one for open enrollment kickoff. I do have one that says welcome to open enrollment. I do have one for the deadline approaching. And then also after the day after open enrollment ends, I send a post enrollment email. So I asked them, was I able to help them? Did everything go all right? If they had any questions, go ahead and email me. But then I also send a survey. So that actually helps a lot. So I'll know what areas I need to focus on for next open enrollment, or the other clients that I have come in that may need help for that for this year or this coming year as well. Um, I also included dates to remember. So for the ACA, of course, open enrollment begins November 1st. December 15th is the last day to enroll for January 1st coverage. January 15th is the day that open enrollment ends, and it is the last day for coverage that begins on February 1st. And then I put in a little note down there. Of course, you know that people have SEP, so the special enrollment periods that they'll be able to qualify for. So I talked about those earlier: a marriage, death, a divorce, a child, a change in income, a change in state, city, or zip code also qualifies them for a special enrollment period. And although I do not, yeah, okay,
You good? You good?
okay,
Just putting up.
I got you. And then also, like I said, I don't currently do Medicare, but their AEP, the annual enrollment period, that begins October 15th. And then December 7th is when it ends, and all those plans January 1st. And I'm pretty sure there is so much more in that space that I am not familiar with. But I did want to at least include those dates in the presentation. Um, do we have any questions, comments, concerns?
Oh, well, I don't know if you're about to get in, but as far as the majority of your clients, do you see that they're coming from events, and is it events or referrals or mix?
Okay, I have a nice mix. I have word of mouth clients. I have a lot of word of mouth clients. I get help on demand clients that come in, and then of course I get clients from events that I've worked. And I also meant to share, although I don't do Medicare, I don't turn clients away. There's a way to still get something. I can actually go through my health Sherpa, and there is a Medicare portion, and then you actually have a dedicated phone number or a phone line that is just yours. And what I do, I connect the client with Health Sherpa agents, and then by them using my phone number, when they connect it, I'll get up to $200. So depending on what they get, I think it's $100 for the supplement, like a med sup, and then dental, vision, hearing, and something else, they're like $25 a piece or something like that. So there it is, a way to still get um, credit for helping these people. Although you don't have your AHIP certification or you're not in their realm, you'll still be able to put them in touch with someone that can navigate them.
So on that, just to add to that and kind of recap a little bit, as far as when it leads, a lot of I won't speak for majority of LSG when we first started last year, right? And some started before then, right? But the majority of the group started in 2023. And when everybody's getting into doing events, and when we realistically got into open enrollment, all the legwork that we would have did before wasn't done. Like y'all have done an amazing job in 2024. So a lot of things as you go through the process of contracting, you'll see help on demand, and then a lot of those things have came. But from experience dealing with all of speaking with all of you and those that's not on tonight, a lot of crazy stuff happen on help on demand too, right? So you will get Lori had somebody from Florida over to Illinois and all of those. So you get a lot of things where you build a relationship with people based on your zip code and things like that too. So I just want to add that for those of you that have not started, definitely you have a tool that you can use that's there.
Can I ask a question?
Yeah, go
Yes,
ahead.
you
It's a
can.
dollar a question.
Yeah. So I keep hearing the zip code, and when I'm thinking in my underwriting mind, as far as banking or whatever, zip codes dictate, again, in the underwriting aspect, zip codes dictate how great of a plan or whatever, so on and so forth, in that aspect. So in the health space, because I'm completely ignorant to this space, if you will, right? So in this health space, what does that zip code represent to these carriers, if I may?
To me, how I see it, the zip code represents the demographics. They do based in everything off of the demographics, and then that is what they are offering that particular demographic. I can take Miss Lori for an example. I know that she only has a few carriers in her area. Like I don't know the details, but I know that she can't offer like a Cigna Platinum 3200 plan because that's not what's offered in the area. Like it literally dictates that it's based off the demographics and then what they're willing to offer in that area or pay for.
Can I chime in on that too?
Yes,
Like,
ma'am.
it's literally like literally like almost by county. Because like a neighbor, like I'm 2.5 hours south of where Cedric is located. When I put his zip code in, I've got like 6 to 10 carriers that pop up. In my area, there's literally like Blue Cross Blue Shield and Health Alliance, and 45 minutes down the road, it's just our central areas only offer that. And from what I was told by the regional managers is that kind of bouncing off what Marquita said, it's not only just the demographic area, but it's the demand of the type of plan that's in that area as well. So apparently like the competition or the politics of the plans, it's not a high demand for Cigna in this area. So just to kind of ad lib on that.
Well, if you got questions, shoot them out there. Definitely get the questions out there. Open enrollment is there. Definitely remember that there's training on Thursdays. Even if I don't post it, there is training on Thursdays, but we like to do a little. You can practice this. This is the straight locker room, and also where you can ask your sidelines too as well. Based on personal experiences, I heard it all. So definitely ask your questions. Can you show your health Sherpa?
Yes, give me one moment. Let me get to it.
So with that, I did want to give everybody an update that the no longer will you use the contracting in a TKO website like we were doing with all the different pages, and you will go to the Mighty Networks, and then you will see all the updated steps from Mr. Rob Raw. Also in the LSG drive, because I just finished my FFM, right? I downloaded the poverty detail guidelines. It says 2024. Go to the website to get the latest and greatest. Don't focus just on the drive. But you will see that in folder number 14 of health, and also to I'll pass the mic back to you. If you didn't hear, we will be staying with peak performance for ACA, and the comp has gone up. So I dropped a bonus, some information in the drive too as well if you haven't seen it, but it is also in Mighty Networks. So want to get put that out there.
All right. Let me share my screen. Can everyone see my screen?
Yes.
All right. So on Health Sherpa, when it comes to the bonuses, this is where what I was talking about for the Medicare. Everyone has a unique number. and it tells you when they're open and how it works. And they do it for every state. So even if it's a state that, like I said, you don't have a license in, well, you know what? Let me not say that. Let me retract that one. I got to make sure, because I only done people in the states that I'm licensed in. But I will actually do more research on that and come back to it. But yeah, up to $200 per Medicare. I mean, who wouldn't do that, especially if you hadn't had to go through that certification or you hadn't studied? Um, what exactly did you want me to do on a Help Sherpa? Like do a quote?
Yeah, if you can, one to point out first of all for, and I'm speaking because I can't forget about, I'm just a year in, right,
Yeah.
compared to all my seasoned agents that's here, and so I'm speaking to those that have not done it. So one, you got your own site that's here,
Oh
right?
yeah.
And that's going to have all the information. You'll have your you can your search engine, and then you can start your application. I'm keeping that basic to everybody that's been doing help for a while. So
Okay.
once you get into it, don't think that you got to go on and do something else. And everything's really going to be here in this platform and your health Sherpa, and then people can also see that too as well. So hopefully I kept that very basic for everybody. So if you could maybe just show one quote, and
Okay.
then we'll wrap up unless anybody has questions.
All right. The
Oh,
food,
and
the
just
food
just
bag.
to add one thing. Look,
Yeah.
Lori just dropped that check the chat.
Yep.
Lori just dropped a message in there about you got your unique phone number that's set up that's there.
Hmm.
So that's definitely what I was trying to hit on. So thank you for that.
Every client that I have set up with it have had no complaints, none whatsoever. So that makes me feel good to be able to say, hey, this is what I do for Medicare clients or people that I would normally help, but I can still get them help. Because trust and believe, if they did not help people, I would not recommend it. You wouldn't even hear me talking about it. But so far, everyone that I've sent over there, they've had no issues at all.
Good to know.
Yes. Someone throw out a zip code for me.
Don't do Lori's.
I show up at mine and they're
Look, she
like,
threw one out. No, you know what? Let's do Lori's,
Okay.
and then let's do one in Chicago. We'll get one from Sandra, just to show the difference.
Okay. Um, I'll just keep it still 35 female household members of one. That's fine. So, what income? How much does this person make?
Above poverty. Oh, she dropped it. 35,000.
Okay. Gotcha. 35. 1, 2, 3. Boom. So, according to this is just a guesstimate. This is an estimate. Nothing is in stone until we actually put in every single bit of information. But according to their savings, they could save up to $493 a month, and this is their cost sharing reduction. And then I can be able to go down to their health plans. Look, Blue Cross Blue Shield premium is $1.33, $1.33, but their deductible is $0. But look how much their drugs cost. Look how much their doctor's visits are. That's not something that you would ideally, you know, advocate for your client. I'm sorry, it's the drugs for me. I can't. Jesus.
And can I also add too, because I deal with that part a lot. For clients that if they are completely healthy, they are not on any kind of medications, and they don't go to the doctor very often, and maybe just once a year, just for their routine physical, maybe for work or something, then that type of plan that Marquita just showed would be ideal because they rarely have to go to the doctor. But for somebody that's on a lot of meds and all that, that's definitely not one you would want to pick.
Yep. Look, you see, I'm basing it off of the drugs alone, because a lot of people that want an ACA plan are people that have ailments. They are already on drugs. They actually not on drugs, medications. They take medications regularly, and then they have to visit the doctors, whether they're seeing their PCP or different specialists. So I actually look at doctors, visit specialists in the drugs coverage. That's just something that I always do. But also over here, you can, I'm sorry, I'll go over here. You can add their doctors or hospitals that they actually go to see who's actually in network. It makes it easier because down here it'll be green and it'll say Dr. Smith takes, this is in network. It'll be green. If they're not in network, it'll be red. Same thing for the prescriptions. It'll say this prescription is covered under the plan. If it's covered, it's green. If it's not, it's red. Um, and then there's the carriers. So, what filter were you trying to look for?
It seems like that like it's a whole bunch of different plans. Can you like put a filter, like if you ask them, well, what's the highest deductible you'll go for drugs? $15. Doctor's visits, 25, that's 150. Specialty, $50 and stuff like that. And then when you filter it, those doctors or hospitals come up. Is there like a filter? You know how you filter
No, it doesn't filter like that.
It doesn't. Okay.
No, ma'am. So I can filter it with the deductible. I can filter it with the total actual max of the premium where it would have been.
Only what's on the left side.
Okay. I do it with the doctors present, and then you can filter it by the carriers, their metal levels, the networks.
Oh, and that's it.
But you can also, I went up too far. You want the lowest premium, or you want the lowest deductible, lowest out of pocket max, in network providers.
Okay.
But that's something that, it's 29 plans is not bad, because trust and believe there have been hundreds of plans available, depending on your zip code, and then put in everything that you can do, which is the person's providers. And then make sure that they're in network. Their prescriptions, make sure they're in network. And you do it by carrier. I've done just the like United Healthcare, Cigna, the ones that are actually popular and have done a lot of business for people, and their deductibles or their premiums are like right smack in the middle. They're low to moderate for the premium levels.
Okay.
Yes. But yeah, unfortunately, there isn't a whole lot of filters to this. It's just, this is it. This is it. And that is Lori's zip code that she provided. Sandra has 606. What? Give me 1 second.
60453.
60453. All same numbers. This person, same information, same income, based off the zip code. They only qualify for $277 a month as a savings. This is what I'm talking about. The 117 plans. That's a lot to go through. Let's see how many deductibles are about 3,500. That's close enough. 47 plans with their total deductible under 3,500. What other filters you want to do? Do you want to do it by carrier? Look how it goes from $85 to 101, but their health deductible is $0. We can do it by carriers as well. You can Cigna. You guys do Blue Cross Blue Shield. And
Yeah, can we just see that? Because $117 and some dollars, and you trying to figure all of this stuff out and asking questions, that's a lot. How many Blue Cross? Is it 12? Only 12 Blue Cross and Blue Shield?
Yes,
Okay,
ma'am.
so maybe that's a better filter. We can say, is there
by carrier?
Company, yeah, you prefer. Okay, thank you.
You're welcome, love. Because that's why I was like, once you put in their doctors and their prescriptions, that'll help filter out a lot of stuff too. Because once you come over here and do the network, it'll only show the providers that are in network that you listed.
Okay.
Yeah.
Thank you so much.
You're welcome.
I had a question, and then Lori had a question.
Okay.
So Loretta had asked me this, and what she had asked me, so she's gonna get a government job, right? But what she asked me was when a job offers it, because we know we got they do group too. And understand we coming out the military, so that's not our thing, health. So which one is the one that people go to? Is it better to have one on the job, or is it the better to have one ACA? I know it's kind of pros and cons, but could could y'all speak on that?
Yeah. Technically, if your job offers you a healthcare plan, you have to take it. You can't just say, I don't want it. Unless it is last year's number, it was 8.72% of your annual income. If your plan was not more than 8.72% of your annual income, you had to take the jobs plan. Now, what could have happened, you take the jobs plan, and then if you had a family, a spouse, or things of that nature, they would qualify for the ACA plan because it would cost more to cover your entire family or your spouse or your children, whatever combination it was, that would put you over your 8.72% of your income, because it is a law for the employer to provide coverage for you. It is not a law for them to provide it for your family. And that's where a lot of people saw a lot of their money going out the door, is paying $400 or $500 a month trying to cover their family. And that's just on the medical side. You haven't even touched dental, vision, or hearing. And so what this does, you'll be able to cover the rest of the family, although you're in the household, because there's a button up here. Yeah, I'll just say it's 4 people in the household. let me change that. Okay. So you would add your spouse, you would add your dependents, and then you would keep it pushing. Because once you get to the application part, because this is just the quoting, we haven't even put anything in the cart or started the application. Because again, this is just an estimate of what it will be. Those numbers change just a little bit, not drastically, once all the information goes into the system. Does that help?
Yep, that helps.
All right.
Lori, you had a question.
Oh yeah, it's more of a tip or a statement. One issue that I recently just ran into with a client this year was that she was on multiple medications and sees not only just her PCP, but also multiple specialists. And the system, I found, doesn't always talk to, it seems like Health Sherpa doesn't always talk to the carriers. So if you want to make sure to ensure that the client's doctors and medications are covered, you can go to the doctors tab where it's highlighted underneath the plan, and go, and it'll take you directly to that plan's website, and you can search under providers by their zip code, and you can search the provider's name and make sure that they are actually in fact covered. Because one of the doctors that one of my clients had, it showed that it was green when we did the quote. And then apparently that doctor's office, they no longer take the plan, but the actual website is more current. So that would be the safest way. If they're not married to the doctor, then it doesn't really matter. But for ones that really want to stick with their doctor, you want to make sure you at least check from the actual website. You can also do the same thing with their medications and make sure that their meds are listed on the formulary. And that's also next to that green tab where doctors is at. You can look under drugs. I just want to throw that out there. That saved me quite a bit of headache.
All right, all right. Thank you for that, Lori.
You're welcome.
Well, it's always awesome to have. I love to CYA. I haven't had any issues with prescriptions or doctors so far, but I will make sure that I'll take it the extra step with making sure using that green button for the drugs and the providers that they're actually in network. So thank you. Do we have yep, you good?
Just one. Can I just one more question, if I may?
Yes.
So I just want to make sure it's clear across the board with you guys. Because I don't think I'll be into the health space, but if I do come across people, is it okay that I send them your way or refer them your way?
Yes, sir.
Look, I
Okay.
needed everybody to unmute and say yes.
Yeah.
Yeah.
I just want to make sure because I don't want to shoot nobody and then y'all don't respond, right? You know what I'm saying? But I just want to make sure we got a
Hell
collective
yeah.
understanding. Say hell yeah.
It's like asking if we do you want this money or no money? But I'm glad that you said that. So two things that I to speak to that is one, you we wanna share the